What to do when angular cheilitis keeps coming back? Treatment for this condition is simple and depends on the underlying cause and whether there is a bacterial or fungal infection. Most patients find that using an antifungal cream can clear the infection and keep the affected areas free from recurrences. If you can't seem to find relief from the pain and itching, talk to your doctor about the best course of treatment. The first step in treating this problem is to find out what is causing the problem. The causes of angular cheilitis vary widely. A bacterial infection is more likely to cause recurrences, while a fungal infection is the most likely to be a lifelong chronic condition. In some cases, a bacterial infection is the culprit. If you suspect that you have a bacterial infection, your doctor may prescribe a topical antibiotic to treat the underlying infection. Surgical treatment is the most effective treatment, but you should be aware that it may take up to 2 weeks for this condition to clear up. Even after you have had a successful surgical procedure, it may recur. In the meantime, you can try over-the-counter Lotrimin, which is an antifungal agent commonly used to treat jock itch or ringworm. A barrier on the sides of the mouth before bed is another way to prevent the development of chapped lips. Some doctors recommend Cerave and Aquaphor as well. Medications and cortisone-based lip creams are effective for reducing the pain and discomfort of angular cheilitis, but they will only work temporarily. If angular cheilitis keeps coming back, you need to find a solution. It's important to seek medical attention to get rid of the condition for good. Taking antibiotics or cortisone-based creams is not the answer for this condition. If you have angular cheilitis, you should see a medical professional. Although these treatments are effective, they won't solve the underlying cause of your condition. If you continue to experience cracks or a painful angular cheilitis, you need to see a dermatologist immediately. These treatments may help reduce the pain and discomfort. It's also important to find out the exact cause of your angular cheilitis to make sure that it does not spread elsewhere. Besides medication, you should also seek dental care. You should get your teeth checked if you have angular cheilitis. Correcting the misalignment of the teeth will help to clear up the condition. While angular cheilitis cannot be prevented, it can be prevented. There are some things you can do to prevent angular cheilitis from coming back. If angular cheilitis keeps coming back, you should visit a dentist. If you have had the condition for a long time, you should seek treatment as soon as possible. In some cases, antibiotics and cortisone-based creams may help to alleviate the symptoms. Regardless of the cause, you should consult a doctor for proper diagnosis. The topical antifungal cream contains butanafin 2%, which can help treat angular cheilitis. Lotrimin Ultra is another product with antifungal properties that can be applied twice a day. This medicine can also help regulate the condition and reduce the number of outbreaks. If you have an active fungal infection, you should consult with a doctor to receive an appropriate medication. Treatment for angular cheilitis is essential. Medications like cortisone-based creams and antibiotics can ease the symptoms, but they don't cure the underlying problem. A dermatologist can prescribe an antifungal cream to help with the symptoms. The doctor will prescribe the appropriate medication that will help you heal the underlying infection and relieve any pain. Aside from oral antifungal medications, you should see your doctor for a diagnosis. A fungus infection is not contagious. A topical ointment that kills the fungus is the best way to treat this type of infection. If you have a bacterial or fungal infection, you may need an antibiotic that kills the fungus. If you suffer from AC and want to look normal again, click the link in the description below to discover a natural treatment for angular cheilitis. Thanks for watching.